Hello, my name's Dr. Wally Curran from the Winship Cancer Institute of Emory University. I'm really excited to introduce two outstanding investigators who will be presenting their work at the annual American Society of Radiation Oncology meeting this week on a virtual platform in the meeting's plenary session. The plenary session will only have two other presentations, and the presentation delivered by Doctors Jani and Schuster will really feature an extraordinary work in which they will report the results of a randomized trial of men whose prostate cancer recurred following surgery, in which a novel radio tracer known as flucytidine is being used to augment PET-CT to improve the results for this prostate cancer cohort. And the results are really remarkable, and I'd like to introduce Dr. Jani to tell us the results of the study.
Well, thank you, Dr. Curran, for the introduction, also for your and Winship's support of this study. This is an NIH-funded study in which myself and Dr. David Schuster in nuclear medicine, who you'll be hearing from in a few minutes, were co-principal investigators. The motivation for this study was that prostate cancer patients who get prostatectomy, particularly those who have aggressive features, can and do fail. And those that do, by definition, have aggressive cancer. We typically give radiation in this setting, but we are not getting the results we would like. Failure still occurs at a very high rate, about 25 to 60% or so of the time, depending on the exact situation. There are a number of investigators approaching improving survival rates from different angles, but we feel that imaging has room for improvement. In this particular setting, conventional imaging, the bone scan, CAT scan, MRI scan, all have low diagnostic yield. It's an area where we're pretty much shooting in the dark, and we wanted to improve the results by improving the imaging. And it wasn't really until we developed these novel PET radio tracers that Dr. Schuster is going to describe where we really started making progress. So the particular study we did, again, was NIH R01 funded. We had patients who had detectable PSA post-prostatectomy, who were randomized to a control arm where all they got was a conventional imaging, and that's what radiation was done on, versus an arm where they had one additional stop in nuclear medicine where they got the flucytidine PET-CT scan. We followed the patients and measured cancer control, principally by PSA, but also by other measures. For many reasons, doing randomized studies of this type are very difficult to conduct, and very few, if any, have really tackled cancer control as the primary endpoint. But at 3 years, we did find that the group getting the PET scan had better cancer control rate of 63 versus 75%, so about a 12% difference, and this persisted at 4 years as well, where it was 51 versus 25%. We think the improvement was seen because the novel PET allowed for better selection of patients for radiation, better treatment decisions, and better radiation target design. So with that, I'd like to turn it over to Dr. Schuster, who can explain further details, especially on the imaging end.
Thank you, Dr. Jani and Dr. Curran. Flucytidine was developed at Emory by Dr. Mark Goodman, and this is a synthetic amino acid, a PET radio tracer. And amino acid transport is upregulated in many cancers, including prostate cancer. And we took advantage of that to increase the sensitivity of imaging to recurrent disease. Now, we knew that the diagnostic performance of this PET radio tracer was better than conventional imaging. We also know that it changes management, but did it change management in the right direction? And this study has allowed us to take imaging one step further and to determine if by using the imaging, we have influenced outcomes for the better, and we have. This type of research is enabled by the collegial atmosphere that exists at Emory and Winship. And in fact, we worked out the framework of this trial at lunch in Emory Village. So I'd like to give a little plug about team science. As we all know, team science is the key to moving forward now and in the future. And this approach will will even be supercharged at Emory as we complete certain key strategic milestones, such as the Health Science Research Building 2, which will replace our current imaging research facility, as well as the Emory Midtown Cancer Tower, which will allow us to provide the newest in these types of therapies and imaging, which enables these therapies to our patients. And that is really why we're here.
Ashesh and David, thank you very much. I do have one question for you. What is next? I understand we call this study Empire 1, and there's a rumor out there that there's an Empire 2 study. So Ashesh, could you tell us about that study?
Yeah, sure. And thank you for the question. As you pointed out, this is a trial that looked at flucyclovine, which is the FDA-approved imaging study in this space. There is an active area of investigation using PSMA, which is prostate-specific membrane antigen. And we have an open trial that has that's about a third of the way done, actually. It's also NIH-R1 funded, and it's comparing in a randomized manner flucyclovine against PSMA in this exact setting. So stay tuned for the results of that.
Great. And my final question is for you, David. Move us forward those several years to when HSRB2 and the Winship at Emory Midtown building will be open. What kind of imaging agents or radio tracers might we be testing both in the laboratory and offering among patients?
Sure. I think that we will continue looking at amino acid transport. I think the next area to look at is for the brain and how we can improve brain imaging as well. With this already FDA-approved radio tracer for prostate cancer. But as Dr. Jani noted, PSMA imaging is going to be coming to the forefront. And we're involved right now in some unique clinical trials looking at various forms of PSMA radio tracers, which will help us, we believe, even further delineate prostate cancer. And then the future is even brighter than that as we get into theranostic concepts, where not only can we use the PSMA radio tracers to identify where the prostate cancer is, but in some select patients, we may even be able to treat the patients with such agents as lutetium PSMA, for patients who have metastatic disease. So I think the future is very bright indeed for molecular imaging and therapy.
Great. So this concludes our discussion, but I do want to let you know that this presentation will occur next week at the annual ASTRO meeting at its plenary session. Thank you very much.
Thank you.
Thank you.